very hard for a long time on this proposal. Anytime we talk about change, people are going to resist, although we've heard the cry for several years from the public that we want change in government. We want government to run more like a business. We want to cut administration, cut bureaucratic fat, and put more dollars, more of our precious tax dollars, into direct services to people. And when we talk about managed care in Medi-Cal and having the opportunity to do that, this has been a long time in coming. Because as the chairwoman stated, and I believe my other two colleagues, that I too belong to an HMO, a health maintenance organization. I belonged to one for several years. It's about time that we put Medi-Cal on the same kind of plan that we, as the elected leaders of this county, have been on, and it's worked very well. The only difference is we're getting away from a very expensive way of providing health care, which is a fee-for-service. And there have been numerous studies done that there have been operations, very expensive treatments given because of a fee-for-service procedure that has been going on in this county, in this state, in this nation for a long time that have not been necessary. It's been done because that's the way the system has worked, and that's the way the money has flowed, and a lot of it's been government money, and it's our tax dollars. Unnecessary kinds of treatments, what we're trying to get at is primary prevention and treatment that'll keep people out of that hospital door, less expensive treatment. And by no means will this jeopardize, in my opinion, the health care that Medi-Cal patients will be providing. In fact, just the opposite. It will provide care in a more efficient way. There'll be a limit on the amount of administrative costs. There was not a limit before. And as I understand, Dr. Ross, there'll be something like a 2 to 3% limit on administrative costs of this program. Is that correct?
The figure 5% was thrown around earlier. What we stated with going into this was that the administrative costs will definitely be less than 5% until we engage in realistic dialogue with the state over dividing up the responsibilities and of oversight and accountability, contracting, the RFP process. Until we define exactly who's going to do what, we can't give you a real number. We're not trying to be evasive. We just don't know. My guess is that it will definitely be less than 5%. I know it will be less than 5%. It will most probably be less than 3%, and we're going to try and get it to as close to 1% as possible. That was my marching orders to my staff.
Thank you. And I think if you find that kind of administrative cost, that's very, very low. It's very, very cost efficient. So the idea here is that more dollars go into direct services for people so that more people can be provided necessary care. A couple other comments based on what some of the speakers made about the right to choose. You have a pool of doctors. There's still a lot of doctors out there, and most of them are coming into the health care plans or the health maintenance organizations. And I think you'll find that there'll be a wide range of choice within the organizations. What we're talking about with a single payer system, a couple people mentioned, I have to say, I totally oppose a single payer system. As I understand what that is, it's government based. And I, quite frankly, have seen very few things, services that government provide that are more efficient than the private sector. What we're talking about is getting government out of the service, getting government into the role of holding the private providers accountable for doing the service. This is results-oriented. It's running government more like a business. It's doing precisely what we ought to be doing. So I do not oppose the Clinton plan for that reason. The proposal is government-based. It's a government-run organization, creating a huge bureaucracy, pouring millions and millions of tax dollars into a bureaucracy rather than direct services to people. So that's why this system, in my opinion, is the best way to go. It's managed care, which caps the amount of money each doctor will get, and it's a more efficient service. I think we proved that already in what we have participated in as county supervisors. So it's high time we do it, and I fully support the effort, and again want to commend all of those that have participated. I think it's a phenomenal job. You're never going to have something where everyone is in total agreement, but we've got the best proposal here that I've seen, and I'm looking forward to full participation of those organizations in the health business that are ready, willing, able to participate. And I know that there's one organization that already provides Medi-Cal to patients in this county that no doubt will be able to compete in the bidding process. So some of the people currently on Medi-Cal could well have the same health plan that they do right now. So I think it's just change that people are concerned about no matter what the change, but there's not a doubt in my mind that this change will be for the better in many, many ways, as I've stated.
Okay, so I think we have a very clear consensus here, and we have a motion on the floor. Again, on behalf of the entire board, I'd like to thank all the participants, Supervisor Williams, Dr. Ross, Mr. Sims, and all the other participants. I know that it was a very touch-and-go business to get all of these professionals together and get them to all agree to this proposal and to work with the state and to get their agreement, and I commend all of you. Please vote.
Madam Chair, that motion passes with all members present voting aye.
Next
And
item.
Madam Chair, I would like you to know that our new secretary, Sandy Smalley, was a significant player in helping us to work this out.
Wonderful. Thank you for bringing that up.
Madam Chairwoman, the next item is item number